happens. But anyway, Ashley's here today to talk to us about the swing bed program. So with that, Ashley, I'm going to let you have the floor. I can operate these slides for you if you'd like.
Great, thank you. Yes, if you Google map Caldwell, it will take you to the health department, okay? So, because Caldwell does have a new health department, so I guess MapQuest or anything like that is updated yet. A little background about myself. I have been with Caldwell for about almost 5 years. I started there right out of nursing school. Graduated nursing school in December of 2009. I started there on med-surg, and I slowly just worked my way throughout the hospital. Before I took the swing bed coordinator and case management position, I was in our unit in our ER, so I've dabbled in a little bit of everything at the facility. I just recently took over case management in May, so we're trying to beef up our marketing a little bit, get out and meet everybody, because a lot of people don't even know that we have a program called Swing Bed. So that's what I'm going to talk to you guys about today. I gave you all some goodies, my card, my pamphlet, some hand sanitizer, because it is flu season. Make sure you get your flu shots, okay? And an ink pen and a magnet. It's just some little goodies that we have for y'all. Okay. A lot of people don't even know.
Everybody see that without us dimming lights? Me dimming lights.
A lot of people don't even know what swing bed is. What swing bed is, it is a 24-hour skilled nursing program to where you can have the benefit of rehab before you go home. For patients who have total joint replacements or have been in the hospital and are too weak to go home, this gives them the opportunity to transition back to home safely. Like I said, it does give a bridge from the hospital to home. You do not have to be an inpatient at Caldwell. You can be an inpatient anywhere else and come to us for the therapy program. Okay. There are requirements for Swing Bed. Swing Bed is a Medicare-based program. However, you do not have to have Medicare in order to be a participant. The number one requirement is that you have to have a 3-day hospital stay. Most of the time, if you're going to have a total joint replacement or anything like that, they normally try to get you in there for 3 days so you can go to a skilled nursing or a skilled rehab unit, which is what we offer. You also must require a daily skilled service. We can skill patients for nursing services, which are IV infusions. Like if you have IV antibiotics more than once a day, we can put you in Swing Bed for that. If you have new feeding tubes or new colostomy bags, anything like that, we can swing you for that. Also, if you have dressing changes that require septic technique that can't be completed at home through home health, we can also put you in our program for that as well. We also can swing you for respiratory services. Respiratory services do require 7-day need as well, whether it's nebulizer treatments around the clock or continuous nebs, or we do not do mechanical ventilation yet, but we are discussing it. So if someone needs mechanical ventilation for breathing, we can probably do that as well. We also offer skilled rehab services. They are, you can have physical, occupational, and speech therapy. You don't have to have them all. You do have to have a few of them. Our physical therapy and occupational therapy is what we have right now. We currently do not have speech therapy. We are looking for a speech therapist. So if anybody knows anybody, come to call me. Okay, we are looking for someone. Our physical therapy is contracted out of Baptist Health here at Trevor Clinic. Michael Duggar is our PT. I don't know if anybody's familiar with him. He is a brilliant physical therapist. He's wonderful. And then we have Penny Mahan. I don't know if she's local. She's from Caldwell. She is our physical therapist assistant. So she does the daily care with our patients. Occupational therapy actually comes out of Princeton County. We have them contracted out of there, out of their hospital. Her name is Gina Croft, is our OT. She is wonderful as well. So you guys might know her. She's from Crinton County. And then our occupational assistant is Linda Ort. She is local as well. Physical therapy is anything, like we say, from the waist down. If it helps with ambulation, it helps with gait training, making sure you're not dizzy or unsteady when you're walking. Their occupational therapy, we like to say, is waist up. It is activities of daily living, dressing, bathing, grooming, feeding, things like that. Speech therapy, like I said, we don't have one, so if you guys know anybody, tell them to call me, okay? You can go ahead and go to the slide. Why do we we offer swing bed. It does increase local services. You know, the chamber is always really big about local. Keep it local. It gives our patients the ability to return home. We have a lot of patients from, say, Vanderbilt and from St. Thomas and Lourdes and Western Baptist to where they could do rehab there, but they do want to come home. They want to be able to be close to home. We had a patient a few weeks ago that as soon as she rolled into the hospital, she was like, I'm home. You know, technically she wasn't in her house, but she's seen familiar faces, and that's something we can offer to our community. It also allows for increased family involvement, which we really encourage that. We encourage families that are going to have input in the patient's care at home to come and work with our therapy program, to get with them, to learn how to safely transfer the patients and get them home to where they can go home. Because that is our ultimate goal in swing bed, is to get these patients home safely. Also improved care. It gives our physicians the opportunity to address needs with our patients they might not be able to get in a 3-day hospital stay. Everyone knows that now insurance companies are trying to get you out the door faster. So that does give our physicians a longer time to make their discharge plan to where they're safe at home. We don't want to kick them out the door and then they'd come back a few days later because they've fallen. Also, it does allow for more time for education with the patients and the families. Swing bed is normally about a 20-day program. Medicare, if you are just a base Medicare, not an Advantage plan, but base Medicare, they pay 100% for the first 20 days. No co-pays, anything like that. We try to get the patients home in about 10 to 14 days. If we cannot, we go to our fellow cohorts at Christian Care Center, Rivers Bend, for additional skilled nursing if they need it. We like to keep our days under that 20. Also, it gives extra time to have a good and sturdy post-acute discharge, which just means they have a safe discharge plan for home. I'm also the discharge planner, so they see me all the time. I'm in their rooms all the time, so I become a very familiar face to them. Okay. It's very important to our community. Like I said, not a lot of people even know what swing bed is. The terminology for swing bed actually means we're going to swing them home. They're not in a hammock, the bed doesn't swing or anything like that. It's just the terminology for swing bed. It can assist our people in the community for their additional time to heal, like I've said before. Before this swing bed program, the patients were having to go straight to a nursing home facility for their rehab. And a lot of patients, they don't want to do that right off. It scares them because they think that I'm going to be here forever and things like that. And we just want to let them know that this skilled nursing is not forever. Just like if we have to send somebody to a nursing home prior to going home, we again let them know this is not long-term care. You're going to get a few more weeks of therapy and you'll be able to go home. Go ahead. Okay, these are our statistics from May, when I took over, to now. I like to show people that 77% of our patients do actually get to go home. We had less than 1% from May to now that we had to go to a nursing facility for extended care. If you're asking where's that other 32%, we also offer palliative care, so patients who need end-of-life treatment. So some of our patients do expire in swing bed, but that is the goal. They come there for comfort measures and things like that. So let's see here. So that's where those other little 32% are. Okay, that is everything about swing bed. Does anybody have any questions? I feel like I talked really, really, really fast because I'm a talker. So.
Well, since I'm a potential patient.
Yes.
You mentioned traditional Medicare versus Medicare Advantage.
Yes.
What's going to happen? Because I'm a Medicare.
Okay. The only difference is that you might be required a daily copay. That's the main difference. We have to get authorization and things like that, just like every other insurance. But they normally do not pay 100%, is what I have came in contact with.
Yeah.
Actually, quite recently. So.
Because, my normal, if I remember, my normal hospital copay would be $225 or
Well, this is different because you won't be under medical care. You'll be under skilled nursing care. So they do pay at a different rate. I don't know if it'll be a percentage.
But it could be subject to co-pay.
Absolutely. Yes, yes, that's a big difference in straight Medicare. So Medicare does pay 100% for the first 20, and then it goes to a co-insurance after that. But yeah, with the Advantage plan, you probably will have a copay with it.
Can I add to that?
Sure.
Sorry. Also, the Advantage plans will sometimes give you a shorter length of stay. They may approve for like 7 days at a time, whereas with traditional Medicare, as long as you meet the requirements, you're going to have the 20 days at 100% or the 100 days at 80/20, as long as you're continuing to need the services, the therapy. But those Advantage plans will approve short terms only at a time. And a lot of times they come up on day 7 or day 14 and say, sorry, you don't need it anymore. We're working on a situation right now. They didn't approve it at all. And so the lady cannot use either of our services.
Yes, so it's, insurance does dictate everything we do in healthcare, okay? They really do.
What's the approval based on?
They have case managers and nurses, and they look at the medical information, like Ashleigh would have to send some information from a hospital saying what the need is, and then they look at it and say, yes, no, we'll give you 7 days.
So if I'm done for kids out there.
Right.
Yes, yes.
Well, the physician should have.
No.
They do not. No, they do not. And that's what's sad. Nowadays, insurance companies are dictating what our dogs do.
Right.
They really, it really is.
Is that all the Advantage plans?
Yes.
Because we have Humana, and we've never had a problem with that.
Yes.
No, we
that-
haven't either.
I will say in our experience, and I know Ashley can speak on it from the hospital side, Humana has been the easiest to work with and the best one that will give the most days, but in this case, this was Humana, and they said no.
Well, I mean, that situation, it was a compliment to us because they were like, we do not want to do, it's called a SNF unit, a SNF to SNF transfer, skilled nursing facility transfer, because it said that she's getting perfectly good care where she's at. But as a hospital, we do like to keep our days shorter because we do have sick people in there as well. You know, normally our swing bed patients are not ill. You know, they're here for rehab and that's it. And so we do try to get them out quicker so that they don't have to be worried about getting pneumonia or getting the flu or whatever is going on in the hospital at that time. So yeah, that's an issue we're dealing with right now actually with Humana. But she's right, Humana is very easy to deal with on a majority of the time. This is just a rare occasion. Just so you're having your hip done?
Yeah, probably so.
Oh, please come see us. We have a really good therapy program.
We did, so
Yeah.
Hey, I'll make the rounds. I
all
can't
those things too.
Yeah.
get me out of there and come over there and then come over here.
That's all right, that's all right.
I'll make the rounds.
Could you tell us a little bit more about the patient?
Oh, yes.
Paying attention?
Yes, no, I haven't even touched this slide yet. I threw this in there. We now offer what we call patient portal. A lot of larger facilities have this already. It's where you can go online and view your health information. Gives lab work and things like that. You can't view radiology results at this point, like X-ray results and things like that, but you can do labs. If you have been an inpatient or an observation patient in our hospital, your visit will be there as well. I mean, it'll say who your nurses were, the last time your antibiotic or whatever you had was given, who your doctors were, who took care of you. It's a really good program. So if you guys want to sign up for it, if you guys have had anything done at the hospital within the last 60 days, I'll be able to find you in the portal. So you can just call me at that number and I can get y'all set up. You do have to have a working email. You have to have an email address to be set up on it. That is something we're offering now, so I wanted to throw that in there to you. It does show your med list, it shows your medical history, things like that. So it's a pretty good thing that we can offer to our patients now.
Is it where you can print it out?
Yes, ma'am.
That's good.
Yes, it's really good. Our lab work, it has a 3-day delay because we do want the physicians to get the lab results before the patient does. So they can take care of anything that's abnormal. So the patient just doesn't be like, oh no, what's wrong with me? No. So so there is about a 3-day delay, but you will be able to see labs and things like that. So it's a really good, it's a good thing we can now offer. We've only been offering that since about May as well, so.
It requires a password and all
It
that.
does, absolutely. It is completely secure, yes. Yeah,
And
when
the
you
pass
call,
on too. It's
yes,
wonderful.
yes. Whenever you call me, I actually give you a PIN number, that once you use that PIN number is, you know, like no one can ever use it again or anything like that, so you don't have to worry about someone getting in there and getting your information, ask you security questions, things like that, just like signing up for anything online. It'll ask you all the secure messaging and things like that. Anything else?
Good job.
Great. Well, thanks, guys. I talk really fast, so please just let me know if you
I
get
have a question, do you have a limit as to the number of beds you can assign this one?
I have not been given a limit as of this time. They actually want me to keep 12 or more on a daily basis. We are a 25-bed facility, so that's half, you know, half of our beds is what they're wanting us to keep with swing bed. Currently, I have 11. But if I go over that 12, then that's a good thing. You know, they want me to do that, so.
So any of your beds can be swing beds, you don't have a specific unit?
We do not. I'm actually, that's one of the goals I'm working on, is getting, because we have two hallways, we have a 100 hall and a 200 hall. I'm actually trying to convert that into a skilled unit, you know, just have everybody on the same hall and trying to get a rehab room. Yeah, it's gonna be a big thing, okay? I'm trying to vamp this baby up a little bit, so, yeah. So,
Thank you very much.
thank you.